Well, good morning, ladies and gentlemen, and welcome back to the Backing the Bold podcast. I'm your host, Vip Vipperman, and excited to be here this morning with Andreia Trigo and Frank Sullivan from Enhanced Fertility. Looking forward to learning a little bit more about their business, how it got started, and the impact they're having in the world. Andrea and Frank, welcome to the podcast this morning.
Thank you for having us, Viv. It's an honor to be in this podcast and share our journey as entrepreneurs and as humans, and also as a couple who is helping so many other patients and other couples conceive.
It's a
Oh,
pleasure to be here, Vip. Thanks for having us on the show.
yeah. So, first off, where are you guys in the world?
That's a great question. So, we are at the moment in Lisbon, which is Portugal in Europe. And we are splitting our time between Portugal, Lisbon, where we have our facilities and fulfillment for Europe, and London in UK, where we fulfill all the UK and the British patients.
Nice. So you're especially connected to our European team based in Zurich, Switzerland. That's awesome. Well, I'm so glad they discovered your work. Well, this morning, why don't you start off with telling us a little bit about your backstories? How did you become entrepreneurs? How did you get involved in this specific area? I'm fascinated to hear how things got started and started as early back as college.
Yes, so I think Frank and I are entrepreneurs at heart. So this is not our first business, but it's definitely the one that is the most special to us and that means the most to us. So whilst we've had other businesses successful in the past, this one is special because as a woman, I was diagnosed with infertility many years ago. And it was very difficult to cope with the reality that I would never be able to have my own children, that I would never be able to experience pregnancy. And Frank, even though he's our CTO, my co-founder, he's also my husband. So he understands what it is to be a couple who is not able to experience motherhood and fatherhood the traditional way. So this business means a lot to us. We started working many years ago with universities in London, trying to understand what the problems are of people who are trying to conceive or who want to conceive later in life. How do they learn about their fertility? And if there is a problem, how long does it take for them to access care? And what does that care look like? So that brought us to Enhanced Fertility because we really think that the solution we have can transform the way reproductive medicine is at the moment. But I'll let Frank tell you a bit about his entrepreneurial journey as well.
Sure. The very first company I started failed. It was a harsh lesson to learn, but experience is the harshest teacher. I've had a career in technology. I started with Rackspace and Microsoft, and about nearly 10 years ago. So in 2016, Andreia and I were working together. My company was brought in to help with some app development, and Andreia was leading some clinical research at a hospital in London. We were working together. This was looking at reducing chronic pain and opioid addiction and changing workflows. Andreia was an anesthetic nurse, and I was the geek. So you've got the nurse and nerd combo. She thought I was very boring, very professional, and very serious, and naturally I had to prove her wrong. So I waited until after the project. I asked her out. Foolishly, she said yes, and here we are a decade later.
Nice. That's awesome. I was gonna ask how y'all connected. That's awesome that you shared that as part of the journey.
But I'll conclude on this point, something that is absolutely critical to our why, our purpose, and the faith that we have that we're on the right path. And that comes down to actually what I fell in love with in the beginning, which was Andreia's conviction and her belief, very similar to what Viktor Frankl said in the book Man's Search for Meaning, saying that we can't we can't always control what happens to us, but we can always choose how to respond. We have to accept that sometimes there is a reason beyond our understanding. And our response, despite our lack of understanding, was to act in service of others, to work on something greater than ourselves, and try and find something that can reduce the suffering of others. And we found that, despite research with universities or working in the public sector, hospitals, healthcare is largely delivered by the state in most of Europe. We found that having our own business, our own, impact business was the right vehicle. It is entirely possible to do a lot of good and scale quickly and make a good return on investment when you've got the values and the priorities clear. And without the red tape, this is the only way that we can scale that impact. And look, we brought 33 babies into the world indirectly. We're not a treatment provider, but that's kind of like the North Star metric for us. We call it NBS, Net Baby Score.
Nice. That's awesome.
And the idea is that it's not the ones and zeros, it's not the tech, or it's not an individual workflow or one single contract. The outcome that matters to a patient is a healthy live birth, right? Nobody wants treatment. No one wants to be in that difficult circumstance. So if you can get the team and you can get everyone aligned towards that North Star, that higher purpose, in a way that's measurable, in a way that's impactful, and in a way that others understand, your chance of delivering a really valuable service and a really good thing to others goes up massively, because everyone understands the purpose. They know why they're here. And I'm talking way too much, Vip. You can't let me do that.
No, I love it. That's awesome. It's so cool to hear y'all's passion for this.
Yeah.
And the reason you became entrepreneurs in the first place. So talk to me a little bit about the specific problem that you saw. I mean, like we know that like infertility is a big problem, like in general, and that there's lots of different people who have worked on it for years, like in the medical field and that type of thing. But what is it that you guys saw in particular with this issue that caused your entrepreneurial juices to to get flowing? Does it work?
Yeah, yes, I can take that one. I started noticing on research that regardless of which country where people were located, that the time to access a diagnosis and accessing a reproductive specialist was too long. It was taking between 3 to 5 years on average.
Oh, wow.
And that's very shocking when you think that you can go from country to country, but the problems remain. There is a problem accessing the right diagnosis, accessing the right specialists. So for us, we are trying to understand how can we speed up that diagnosis and speed up access to the doctors that can really help you. If we think about a woman in her 30s, early 30s, by 5 years means she'll be 35, which is the time when fertility starts declining. And it can be the difference between having one baby or not having any baby. If we're starting to see in Europe where most couples start to conceive around the age of 36, which is already so late, 5 years for them might be not being able to have children with their own eggs. So it's shocking that there's still a bottleneck when it comes to diagnosis. And that's because there's unfortunately not enough doctors to meet the demand. So we have a limited number of doctors and nurses in hospitals and clinics. They are overwhelmed with the amount of patients they have. It's a problem that's growing and growing. And so we know that there's a huge focus. Lots of countries now trying to incentivize fertility. So we found a way of easing that clinical time and admin time so that they can see more patients with that same staff. And from the patient's view, having the diagnosis in less than 30 days instead of 3 years.
Oh, wow.
And that is transformational. It may make a difference between you having babies with your own eggs and your partner's sperm, or not having that.
Wow. So talk to me a little bit about the technical side of the solution, Frank. I know you're she's the nurse, you're the nerd, as you guys said. How does that work out?
Well, interestingly, we've both built successful businesses before. It's not our first rodeo, as you might say.
Mm,
Um, I think the thing that matters most is validation of a technology, of a technique, of a product. A lot of people can come up with new ideas, but if they don't execute those new ideas, if they don't test and iterate and validate and learn from um, those experiments, or failures are just a natural output of experiments, right? I think from the technology side, I view things a little bit differently. I'm not just looking at, you know, what are the clinical procedures or clinical decisions that have to be made. I'm looking at a systemic level, how are those decisions made, and are they made in the right way, and is there a way of automating the manual messy parts that take away from patient care. For
mm,
example, a doctor spending 3 hours on the phone justifying a prior auth, a patient coordinator chasing lab results that were emailed or sent as a blurry photo. There are lots of ways that technology doesn't have to be intrusive, but it's not the primary thing, right?
yeah.
We often talk about our type of business as health tech, but it's very much that. It's health, then tech. Tech should solve a problem in a way that is unobtrusive. If no one's talking about the tech, it actually means that I'm doing my job as a CTO,
I got you.
because things are working in the background. You don't really have to think twice about how the ignition of your car works. You just assume it's going to work unless it's a really cold day. You don't need to worry about your phone. You don't need to know how it connects to the satellite to know that it works, or connect to a phone network. So there are lots of ways that technology can improve our lives when it's embedded into the experience, when it frees up time for the clinician, or when it improves outcomes for the patient. But most importantly, has it been clinically validated? What is the risk of something going wrong, right? An at-home blood test, taking blood from a finger like a diabetes test, that's not the same risk of harm as a pacemaker. So it might be a different
Right.
classification. Or, making sure that doctors' results, or making sure that lab results get from the lab to to the right clinician on time. That's really critical. You can't use like ChatGPT or an LLM to say, I think these might be your results, or statistically it's highly likely that this value is what was originally sent. You have to make it really, really, really tight. You have to make it work.
Yeah, I
Awesome.
think for everyone who's listening, it would be really useful to explain the how it works. So typically, the way it works, we have a fertility clinic that uses our software, which can be used as a standalone or integrated with their electronic health records, and they use it to trigger the patient onboarding process. So the patients receive an email and they complete the clinical history, consent forms, all the paperwork, documentation that the clinics need to be able to start caring for that patient. And they select which tests the patient needs as pre-screening tests.
Hmm.
And that's usually a combination of blood tests for the woman and a scan. And for men, it's usually a sperm analysis. We provide some of those tests remotely across Europe. We're bringing also the scans to be done remotely in 2026. So we're trying to remove as much as clinical facing time as possible to free up the clinical team. And then all the results are automatically uploaded into the system, and it automatically checks against guidelines from ASRM in America and ESHRE in Europe, and the ICD-10 and 11 codes for reimbursement, and produces a list of all the diagnoses that this patient is matched against.
Mm.
So the doctor can do a remote telehealth consultation with the patient, and in basically 2 seconds has all the diagnostic codes that he can review and agree with. It automatically generates the doctor's clinical note based on what the doctor has agreed with, and that can then go to the patient, the insurance provider, and to the electronic health record. And then the next stage of where we're going next is try to help the doctor decide on what treatment protocols are better. So we're trying to re-engineer the patient journey and the doctor journey to save up as much time for the patients, save as much time for the doctor. But I hope that these steps 1, 2, 3 can create like a beautiful, easy picture in the minds of everyone who's listening to us today.
Yeah, no, that's super helpful. Just kind of to explain. So you guys aren't doing per se a new fertility treatment. You're making the treatments that are available technologically more accessible, and just helping to streamline the time that the doctor and the patients has and that type of thing, so that they can communicate quicker, more effectively, and get to the results and then get to the treatment as soon as possible.
That's exactly right, Vip. So step 1, get tested. Step 2, get diagnosed. Step 3, get a personalized treatment plan. So I think the innovative part of testing is we're seeing this big decentralization. So
Yeah.
person goes to test, no, test goes to person, and then they can send the sample in the post back to this network of labs all around the world, and then the data comes securely to you, the patient, or your provider, your physician. And we believe that patients own the data. We don't think it
Hmm.
should be tied to a single carrier or provider. Maybe that's just GDPR and our European data privacy mindset. But we do think that that patients should have a lot more control over their data. Um, Number 2, get diagnosed. If you think about it from this perspective, and Andreia, correct me if I'm wrong, a diagnosis is just a doctor's best guess, right? Most patients forget that. So that best guess is dependent on the quality of the information available,
Hmm.
but also the criteria against which you are judging the results, right?
Yep,
So,
that makes sense.
you know, are you determining whether a patient has a specific condition based on guidelines that are 20, 30 years out of date? Are you um, aware of all of the different permutations? It's not just what you can rule in; it's also what you can exclude. It's saying you do not have this have this disease or condition because
Right.
conditions X, Y, and Z are not there. That's really complicated. I often give the example of, you know, uh, an airline, right? If a flight engineer had to walk around the plane and manually check 1,000 different systems, that plane is not taking off anytime soon. And yet, it's something critical. It's got to be safe. You have to do those checks. So you need that level of automation. If you want to get that plane turned around in half an hour, yes, you need oversight. The human has to be in control. And this is something absolutely critical for diagnostics. It's that when you gather all of this multimodal data, you've got, you know, scans in a specific technical file format. We call it DICOM. You've got PDFs that are getting emailed. You've got blurry images that a patient might send on WhatsApp, or you might have insurance codes that don't make sense from systems that don't talk to each other. All of that information has to come securely into one place, be normalized, and then it has to be presented in a way that the
It's
doctor or the
understandable.
clinician
Right.
can make sense of it, right? So if I put send you an email, 30 photos, and then send you some gobbledygook code, ones and zeros in a spreadsheet, that's not helpful for you as a doctor. But if you can get all of that in one place, standardize it, and then show it as a match against the latest criteria, like the American Society for Reproductive Medicine, it's the world leading standard in preparing these evidence-based criteria, or
Yeah.
ESHRE, the European equivalent, or NICE. NICE is nice. It's the National Institute of um, Care and Excellence, I believe, in the UK, in London. So if you can codify the diagnostic criteria, if you can automatically compare and say this is a match or this is not a match, then and you can present that information to the doctor in a clear way with the right codes necessary for the insurance reimbursement or the procedural coding, you've taken away all of the administrative and manual and time-consuming low-value tasks
Right.
to free up the time and the cognitive space, the head space in the doctor's mind, to focus on what we would call a differential diagnosis or diagnostic reasoning. So now
Nice.
the information is in on one place, but it's up to the physician or the clinician to decide what that diagnosis is. Just because you're suggesting codes doesn't mean that you've got this magical talking hat or super AI system that knows better than the doctor. It doesn't. The doctor has to be in the loop, not just because of the liability or the apportionment of liability, but because it's the right thing to do.
Right.
So anything that takes away the boring, manual, time-consuming administrative tasks like chasing labs, looking up guidelines from 70 different diseases, we automate that and put it all in one place. And then the
Nice.
final super cool, super nerdy part, and I'm probably going to bore your listeners a little bit unless there's some engineers in the room here. This is how do you take historical data from 1.4 million patients, anonymized,
Oh,
and
wow.
turn it into a system that can personalize a plan, a treatment plan for you that's most likely to work. How do you use big data to make small treatment decisions that are most likely to result in a live birth? And that's where machine learning comes in. Machine learning, it's part of, well, AI, machine learning, these techniques. You have to use different models to use different things. Like you wouldn't use a hammer to put a screw into the wall. It's the same thing. You wouldn't use an LLM, a large language model, to do certain things around live birth prediction or personalization. So this big data, we call it the Patients Like Me report. It's a set of tools, it's a set of data technologies on the back end that allow the clinician who's got the tests, now they've agreed a diagnosis, and that's integrated into the EMR. Now they're going to compare those records against historical records from the clinic or hospital or against the open data set that we've prepared. So this is anonymized data from 1.4 million patients over the last 20 years that we've got from the British regulator that says, right, you're a 35-year-old female with endometriosis, you don't drink, you don't smoke, your husband is 46, these are his blood test results. Okay, there are 80,000 women like you in the database. What's worked for them in the past? What is most likely to work for your profile? And then you can start to build on that evidence base.
Gotcha.
What medication, what surgery, if needed, what type of treatment, what type of ART, what kind of emotional support might you need? All of these things can now create a holistic treatment plan most likely to result in that net baby score.
Awesome.
So,
Well, tell me, that's amazing. Tell me a little bit about how it's going. You had mentioned 30, maybe in an early conversation, but talk to me
yeah,
a little bit about some of the, like an experience that really defines like one of your potential patients, as much as you can share, obviously, with,
Yes. Yeah,
sure.
we always tend to share the messages on our social media in terms of baby number 2, baby number 3. We don't want to disclose any, of course, patient confidentiality, but we want to share those stories to remove the stigma around infertility so that other people feel like others are going through it as well and that there is a light at the end of the tunnel. So
Yeah.
I can tell you the story of a couple, and this is baby number 27. We're no longer
Okay.
33, but number 27. This couple, they were trying for 5 years already without being able to conceive. At the point that they got to us, he was tested for male fertility, and his sperm analysis showed azoospermia, which was lack of sperm in the ejaculate. And she tested her ovarian reserve, and she had a very low ovarian reserve for her age. So that's pretty much explained the reasons why they haven't been able to conceive for 5 years, and had components of both male and female factors that were contributing to that outcome. That
Yeah.
coupled with us, they had counseling to try and cope with the diagnosis, because it's very transformational to receive that diagnosis.
Yeah.
And they felt comfortable after counseling to go ahead with IVF, with donor eggs and donor sperm. And then baby 27 was born. So it's always emotional to
Hmm.
me, I think to our team, when we see a positive pregnancy scan, a positive blood test for pregnancy. It's even more emotional when we know there's a baby. And what we want to make sure is that more and more people have access to our technology, our support, that we have more babies around the world. Because this is just one of many, many stories that we have, and it's always emotional to us too when we hear about these stories.
Yeah, that's amazing. Go ahead, Frank. Sorry.
I have a slightly different view on well, sorry, a slightly different story actually, but I think it's one that is equally important for when things don't work out.
Hmm.
I think we offer telehealth, so you can speak with a doctor or a nurse, a fertility expert, or a counselor over the internet. You can book it on demand. You don't need a referral. You don't need to wait, and we can do the testing. So that there's lots of services designed to speed up that access to care, right, and
Yeah.
bring the cost down. But let's talk about outcomes that aren't positive. Lots of treatment, whether you consider it controversial or not. We're not a clinic, we're not a treatment provider, we're nowhere near that debate.
Hmm.
But sometimes when things don't work out, for example, a treatment has failed, or in this case, a couple, one of the partners had passed away. They had gone through treatment. I mean, this is a particularly acute story that may resonate with many veterans, many service men and women in the country, where there is often a risk from one's profession or occupation, and planning a family, starting a family, these things really affect you. So when things didn't go right, I think our clinical psychologist was there. One of the partners had passed away, and that is a really devastating thing.
Yeah.
You know, when patients get bad news, when treatment hasn't worked, when horrendously, we actually deal with a lot of heartbreak. I'm finding it difficult to talk about, Vip. Sorry, but
Huh.
I think when
I mean, I
you
can
go
tell you,
through a miscarriage, or you lose a pregnancy, you lose a child, or you lose a partner, I think having people who are there for you,
Hmm.
I
who
mean
have
that
context.
that couple actually, they were with us for a long time. After testing treatment, they did have their baby. The husband did pass away, but the counseling and support that we continue to provide meant that they were so grateful that they've made a donation to the company to support others who couldn't afford it.
Oh wow.
So we touch so many lives in
Yeah.
times that are truly important for people. And that's really important to us as founders. We want to do work that matters, and we want to create a company that sustains the test of time, that is able to survive a pandemic, is able to survive war, is able to survive whatever is happening in the world, because the outcome of having families surpasses all of that.
That's cool.
I'll give you a third and final case, actually, a family member. Something easy to treat but difficult to diagnose. This patient was trying naturally to conceive for 2 years without success. It put a strain on her marriage. It was very difficult for, the family to watch it go through that. She didn't approach Andreia until later on. Andreia had done the right tests, and it was all done in 48 hours. Andreia made the diagnosis of something called a short luteal phase, which is quite easy to correct with progesterone supplements, no surgery. But that pain of not knowing, that's the worst. It's like you're waiting for the phone call that never comes.
Yeah. But she's now pregnant with her second baby.
Oh my goodness.
And we're going to be godparents next Sunday to the first. So
Oh wow.
It's my
really
sister.
special.
Oh wow. Congratulations. That's amazing.
After 7 weeks of starting the treatment, the medication Andreia put her on, within 7 weeks she fell pregnant with my first niece, and now we're going to be godparents on Sunday. So
That's awesome. It's a lot of fun things to celebrate. And just the impact on the individual lives from the parents to obviously, the child and the potential future that they have and all those amazing parts of it too. So one thing I want to make sure that I do, talk to me a little bit about the business case, like for this situation. Obviously, the impact here is so significant. I mean, we've got friends and other people that we know that have dealt with both sides of this issue, struggling and then finding hope and then struggling and finding no hope, kind of a thing. And it's just a challenging situation. But there's also the business case. If you guys don't grow this business and expand the company financially, that it doesn't get to keep helping these families. So talk to me just a little bit about how the business side works and how that's going.
I'll let our CEO speak first.
Yes, absolutely. So, we want to do good, but absolutely, you're right. We need to make sure that it's a business that is that generates revenue. So it can be a win-win-win situation for our teams and our investors, to the clinic and to the patients. That's what we're trying to find. So we actually have a business to consumer model. We work with fertility clinics, gynecologists, andrologists who are dealing with fertility and reproductive issues, men's issues, women's health issues, and they pay a software license to use our software to onboard, test, and diagnose their patients. The patients pay us for the tests that their doctors recommend. So that, in a way, helps ensure that the patients are doing exactly the tests they need at the time that they need it, that they're not overdoing stuff they don't need to do, or that's really important, or that they are missing out on something that the doctor really needs to go ahead with treatment. So it's a really easy model with a low cost of lead acquisition from the patient point of view, and ensures that we are delivering value to those who need it the most, the doctors and nurses who are saving time, and the patients who actually need to be tested. I don't know if Frank to add anything to this.
Yeah, I've been told off many times by the board and my significantly better half, don't overcomplicate things. To which my response is, don't undercomplicate things at times. Healthcare is a complex, fragmented thing. You can't apply an engineer's mindset without clinical validation and vice versa. Because then, long story short, our business model is simple. clinics, hospitals, and providers pay for the software, patients pay for the tests. That way, it's a dual-sided business model. It keeps us independent. We don't take referral fees. We don't take, kickbacks or incentives or rebates of a sort. We don't get paid to refer from one clinic or another. We're always on the patient's side in offering independent advice.
Nice.
But we do think that beyond clinics, there is tremendous potential for systemic improvement and systemic value creation. Some people on the podcast might be familiar with this idea of value-based health, that you're paying for outcomes, not just inputs or time served in the process. So I think having the evidence, the data, the systems, I think that makes it very easy to make it more transparent and help insurance providers deliver a better, more ethical service. I think for larger hospital groups, especially the vertically integrated ones or private equity backed clinic groups that want to standardize best practice, they've got this. It's not just the operating model. Now you've got the operating system to go with it. And then I think developing new therapeutics. I think 1/3 of infertility is male factor, 1/3 is female factor, 1/3 is unexplained, unknown.
Okay.
There is literally a diagnostic code in the International Classification of Diseases, the one that the World Health Organization uses, called unexplained infertility. How can that be? Here's a database code that says your diagnosis is unexplained. I'm going to diagnose you. Your diagnosis is unexplained. That's crazy, man. That doesn't work for me. So when you can start applying these machine learning systems, when you can start treating the data ethically, but once you can start applying these scientific techniques, these data science techniques, you can start to look for patterns. You can start to uncover hidden populations or subpopulations that can begin to explain certain things. Like we never really thought of polycystic ovary syndrome as insulin resistance or a metabolic disorder on its own, rather than just you can start to come up with new medications. You can start to identify new therapeutics areas. You can reduce that 1/3 unexplained.
Nice.
Unexplained means I can't do anything for you.
Right.
And honestly, the scale we're talking about, 1 in 6 people of reproductive age are going to be affected by infertility in their lifetime. Right? 1 in 6. That's the World Health Organization saying that. And the link will be on the Eagle Venture Fund profile. You'll see the evidence base for all of this. That's a lot of people with a lot of unexplained conditions.
Yeah.
So long term, if every patient and every clinician making a decision through the system makes it smarter over time, we call this reinforcement learning as a machine learning method. There's contributions to broader medicine, and I think the future for this is being able to say, if we can automate diagnostic reasoning, bring clinical decision support systems in that are actually proven and validated. We've already validated ours for reproductive care, and then we can personalize the treatment. Well, I have a scary hypothesis. Scary only because my engineering team has to go and build it. But if it can work for reproductive medicine, could it work for adjacent areas? Name me a disease in the last 100 years that isn't diagnosed with a lab test, an imaging study, a scan, physical exam, or some sort of screener or questionnaire. Can we apply the same method and the same technology and start helping others? Andreia already mentioned general practice and gynecology. I see a future beyond that, where the doctor is always in the loop, but you can take away the boring admin parts of the job and focus on care.
Dude, that's awesome. Well, we've got just a second or two left. I want to make sure to give y'all a chance for the listener out there who's been wondering, so how do I find out more information and where do I get access? I want to clarify real quick. Currently, you guys are only in Europe. Is that correct?
Yeah, we're currently only in Europe, but it's just a couple of months away from the US,
Oh, wow.
actually.
Okay.
Yeah,
So the listeners in the US, there's hope for them too. That's exciting.
yes, we're going to the American Society of Reproductive Medicine conference, which is in less than 2 months away.
San Antonio, actually.
Yes, and we are already in very advanced negotiations with the lab there. So I think it's before the end of the year, we'll be in the US as well. But yeah, at the moment, we can sell all across Europe. We're translated into multiple languages as well. And you can find us on our website, efp.clinic, and of course, all the social media. You'll be able to hear about our babies being born and the clinics we work with and the impact that we are doing.
Well, so thankful for the work that you guys do. So excited to follow some of that social media. I have not yet, and I want to start doing that. That's really, really exciting. Um, Thanks again for the time and effort you guys are putting into this. We know so many lives are going to be transformed, and we're excited to back bold entrepreneurs like you guys. So thanks, Frank. Thanks, Andrea. Excited to see you guys grow and succeed.
Thanks for taking that step on the next on the journey with us.